Students, I'll be teaching you how to perform a pre-warm IAT. So before I start the procedure, I just want to touch on how we read for reactions based on agglutination in blood bank. So the first tube here is a 4+ reaction. Again, that's a positive reaction. That's a very strong reaction. 3+ is also a very strong reaction. And the clumping of the cells at the bottom, we call that a button. So the button comes off very easily. A 2+ reaction and then a 1+ reaction, those are slightly more weaker, but obviously they're still positive. So we do consider that positive, and then we have a negative reaction here. Okay, to start with, we are going to need our patient plasma. We are going to need our unit that we're doing the cross match with. We need IgG. We need check cells, and then our saline. Everything needs to be pre-warm except for the check cells for 5 to 10 minutes. So here I've made a 3 to 5% cell suspension. And then I have my IgG. I transferred some on little tubes so that they would fit in the drive bath. My patient, and then I have my saline. Now I'm going to start with just an empty tube, and then I'm going to add 2 drops of the patient plasma, and then 1 drop of my unit. And then we're going to mix it up a little bit, and then we're going to let it incubate at 37 for 30 to 60 minutes. So after our 30 to 60 minute incubation, we are going to start cell washing. So again, that's my patient. I label it as PT. I have in here 2 drops of patient plasma and then 1 drop of my cell suspension for the desired unit that I'm cross-matching with. So I have my saline here, and we're going to start washing the cells. So we do a 3 to 4 washes, and of course we need to fill these up at the same amount of fluid so then the centrifuge doesn't go all crazy on us. And we are going to centrifuge these for 30 seconds. So we wash and then decant, and then now we are going to add in our IgG. We are adding 2 drops, mixing well, and then centrifuging for 30 seconds. The reason we are performing a pre-warm IAT is because of cold alloantibodies or cold autoantibodies. So those antibodies react at room temperature, and they can really mess with blood bank testing, especially on an antibody screen and of course a cross match. So after centrifuging it, we are taking it out, looking at the reaction. So here it's a negative at IgG, so there's nothing else that's hiding, another antibody that's hiding there. So it's a cold. So of course, after checking macroscopically, we have to check microscopically. We always do that at IgG, Coombs phase. So this is just what I do with a slide. Everyone's different. Some people grab pipette and then put a drop on, but this is what I do. I try to record what I was looking at under the microscope. It's a negative reaction. There's no clumping. It's just our microscope is a little dirty, but yeah, it's negative. So now that you guys have seen a negative reaction, I'm showing you guys just for reference what a positive reaction under the microscope looks like. Lastly, we are doing check cells. So check cells, make sure that you added your reagents, so your IgG, and then it also makes sure that your IgG Coombs phase was negative. And so we add 1 drop. We are going to mix, centrifuge for 30 seconds, and we are going to read the reaction. So now we are checking for reaction for the check cells. And we have about like a 2-3+ reaction, more of a 2+ reaction. So everything worked. So yeah, this is how you perform a pre-warm IAT. Thank you.